So what makes a great retinol? This was a question I had a few years back, and I'm not sure many of you know, but I'm mixed ethnicity. My mom has blonde hair, and my dad has darker skin tones. And so for me, I had difficulty tolerating retinols or retin-A of any sort. And so one of the things we tried to do was develop our own retinol, which took us some time. And we ended up developing 3 different retinols for our patients. And the main issue I saw with most retinols wasn't that they weren't strong enough. Some weren't issues. The biggest issue was how they were delivered. And so when we first started off on this project, we wanted to make a better retinol, and we wanted to improve the delivery system. So there's 2 main components. First of all, most retinols are water-based. And the water-based retinols are like taking a shot. You get all of that at once and it burns. But if you sip on that over a period of 24 to 72 hours, your body doesn't get this redness, this inflammation, and it seems to tolerate retinols way better. Water retinols, they're essentially a derivative of vitamin A. So if you're able to tolerate this better, you're going to have less inflammation. It's going to actually work a lot better, in my opinion. So that oil delivery we use instead of the water delivery is one of those key changes. The second change that we did was the addition of micro sponges. Now this sounds almost too sci-fi to be real, but it's amazing. There are micro sponges out there, and you can actually put them in your skin, or your skincare products, I should say, not in your skin. So what happens is the micro sponge holds onto the product, and it again delivers this product over 72 hours. Between the combination of the micro sponges, which are biologically inert, with the oil, patients avoid this rush of retinol at once, this burn, which is basically almost this chemical injury or peel of that area, which is red, and they get a retinol reaction. And now they're able to tolerate higher strengths. When we first started with this project, we had basically a strength that everyone has, which is a 0.5. We upped our game and went to a 1% retinol. And even then, patients were tolerating this without any problem and having amazing results. So we made the strongest retinol on the market at 1.5%, which is crazy strong. So that, there's a caveat to that. That is my favorite product for retinol, and pretty much a universally loved product. I recommend this product to almost every rhinoplasty patient. Every patient over the age of 30 should be on this because of the anti-aging effects. It actually helps with oil. And I actually think for patients with, for rhino, the reason I like this, it does seem to thin out the skin. And as we get older, patients' skin tends to get a little thicker there. The caveat to that 1.5 being the strongest in the market is we did come up with a 2% version. It's not time released. And this is not meant to be placed all over your face. This is a spot treatment for acne. And it almost evaporates acne because it just kind of shrinks up that oil. But you don't want to put this treatment, and we call this retinol Retinol, all over the face. The strongest product we have on is Retinol Forza. And Forza is Italian for strong. The middle product we have is Retinol Meso, and the lightest product we have is Retinol Leve. Almost all our patients go right up to Retinol Forza. They go with the stronger product, and it is something I used at least once a day, sometimes twice a day, depending on where my oil state is at. And I, believe it or not, held off on Botox. I do fillers, that's no secret, but I held off on Botox because I think I have such a almost religious use of retinol and growth factors. So hopefully that's helpful on the development of retinol, why I use the retinol I do, how we came about it, and why I think everyone should be on a retinol, but hopefully a well-designed retinol is better than a poorly designed one.